So you just heard how nitrates get into our waterway. So now I'm going to invite Audrey Tram Lam to speak about how and why that nitrate is bad for our health. So Audrey has a master's degree in public health from the University of Iowa and a graduate certificate from Johns Hopkins Bloomberg School of Public Health that focuses on food systems and the environment. She currently serves as the Environmental Health Program Director at the University of Northern Iowa's Center for Energy and Environmental Education. And there she leads a host of different environmental health initiatives. And Audrey serves on a long list of boards. I'm not even going to go through all of them. There's so many of them. And for that, she provides a lot of her public health expertise. I'm really glad you can be with us here tonight. I want to welcome Audrey.
Thank you. Thank you so much for the intro and for the invitation. And thank you, Chris, for setting up the rest of our talks so well. We are limited to 10 minutes to sort of give you the topic spiel that we've been sort of assigned for the evening, which, I mean, before Chris, I thought was going to be impossible, but I thought he did a really amazing job. So I'm going to be talking about nitrates and human health. And sort of the headline of this evening was the cancer connection, right? I always like to offer just like a short disclaimer before jumping into a talk that, dovetails so closely to a topic that's so important to Iowa right now. And that is, I'm not a cancer expert. My experience, expertise, my education is in environmental health and in population health. I'm really, really interested in the overlap of ecological sustainability, human health, and how that is sort of layered in the Midwest by agriculture and toxic chemical application exposure. So that's sort of like my happy place nexus and sort of where I'm coming from this evening. So I do think a lot about pesticides, and I hope we get a chance to talk a little bit about that later too. But I'm going to try to give an overview relatively quickly on nitrates. And I'm going to make sure I keep myself on track just because it's kind of hard to see the clock over here. So in addition to that disclaimer was the disclaimer I gave earlier about trying to cram all of this into a short talk, right? Here's my tentative outline this evening, right? I want to give an overview of some regulatory considerations as we think about sort of the context of exposure in the Midwest, how nitrate may lead to cancer. I think that's actually probably one of the most interesting things about maybe this slide deck is sort of how does nitrate contribute to cancer and ill health effects. We'll address populations of concern, like who that could be exposed are we most worried about. And then a very, very high level overview of health issues, both in children and in adults. And I want to just give a huge shout out to my colleagues at the University of Nebraska Medical Center for allowing me to borrow some material for tonight's talk. They do a lot of really, really excellent work with nitrates and human health over there at the Water Center, especially looking at pediatric cancer. So I would strongly recommend them as a resource if this is a topic of interest to you, especially from the human health side of things. Okay, so hopefully that all sounds okay to you, and hopefully you're all following me with how quickly I'll talk tonight. Okay, so the regulatory limits of nitrate. Some of you probably already know this, and I would wager you probably all know this. But the regulatory limits of nitrate in drinking water are actually set to protect against acute health harms, right? Not health harms as a result of chronic low-dose exposure over time. The Environmental Protection Agency's MCL, or maximum contaminant level, limit is 10 parts per million of nitrogen. And that's a level that's not enforced in private wells, right? It's a safe drinking water standard that really only gets enforced and regulated at the public drinking water level, which is why people drinking from wells are particularly vulnerable from nitrate exposure. But this acute health harm that we're really worried about is something called methemoglobinemia, or blue baby syndrome. So babies that are 6 months old or younger that are formula fed using tap water that may have high levels of nitrates are at risk of having their sort of the oxygen that's sort of supposed to hang on to the hemoglobin in the blood, having that displaced by the nitrates. And so these babies won't be able to really oxygenate tissues very well, and they literally turn blue. So that's blue baby syndrome. It can be fatal. And so it's really good that we have this protective limit. But like I said, the EPA's MCL is set for an acute health harm, not necessarily something that we would maybe see drinking lower doses of nitrate over a longer period of time. There's actually been quite a lot of studies that have looked at the relationship of nitrate to human health. And we know that high concentrations of nitrate in drinking water has been linked to adverse health outcomes. And actually, even sort of moderate or low levels of nitrate have been linked to human health outcomes. The strongest links in the literature are sort of lumped into the acute and the chronic. These minor health ailments, which sort of I'll run through a little bit later, methemoglobinemia, the blue baby syndrome that I just talked about, preterm birth issues, including sort of spontaneous abortion, sort of early delivery and labor, low birth weight. We're worried about birth defects with exposure to nitrates during pregnancy. And then there's pediatric cancers and adult cancers. Okay, so this is the slide that I'm actually pretty interested and excited about. This is used often by the National Institutes of Health to sort of talk about what compounds in this sort of process of nitrate exposure are actually maybe the probable human carcinogens. So some of you may not know this, but nitrate isn't actually the thing that we're worried about with the cancer link. It's sort of the transformation products that are worrisome. So when we are exposed to nitrate through drinking water, through diet, the bacteria in our mouths start converting that nitrate into nitrite. And then when that combines with compounds in your stomach acid, it further transforms into these N-nitroso compounds, or these NOCs. And it's those that IARC and other sort of public health bodies of authority are sort of pointing to as the probable human carcinogen in this sort of biological mechanism here. This process is also catalyzed by heme iron, so the iron that's found in red meat, and by compounds in cigarette smoke, but it's inhibited by antioxidants or vitamin C. And there's actually quite a lot that we could talk about here when it comes to dietary exposure to nitrates. So maybe nitrates that you would get through fruit and vegetable consumption. That we can get into, and sort of why we worry a little bit less about fruit and vegetables containing high nitrates, mostly because of the package, the whole food package that they come in that has a lot of antioxidants. But we will save that for another time. We're really focused on dietary intake of nitrate through water as being problematic because of how it transforms into those NOCs. Hopefully you're all with me so far. Okay. Populations of concern. So we're in public health, we're always thinking about particularly vulnerable populations to exposures or to social determinants of health. Agricultural chemical exposures, no exception. There are categories of people that we worry a little bit more about. Pregnant women and their fetus. This is of high concern given what we know about some of the maternal health outcomes that we're seeing in the literature. And given that it's such a short window and an extremely important window of development, we're seeing that there's some pretty not great health outcomes that if we have time, maybe we'll talk a little bit more about. Young infants, like I said earlier, those that are 6 months of age and younger, and young children are at risk. And then people with oxygen transport or delivery conditions, things like anemia, cardiovascular disease, the presence of hemoglobin abnormalities, those folks are at risk of nitrate exposure, particularly at acute or higher levels. And then, of course, people with high nitrate in their well, right? And that's, kind of code for rural populations, right? People who rely on well water for sort of all of their needs. So these are the folks that we're particularly worried about with nitrate exposure. So these health issues in children that show up a lot in the literature, multiple health issues have been identified in children, right? Of course, the acute, but then we also have evidence that pediatric brain cancer has been linked to nitrate exposure and then non-Hodgkin's lymphoma. And very interestingly, the non-Hodgkin's lymphoma point, there was a study done actually out of Nebraska in 2013 that showed that there was a threefold increase in risk associated with nitrates and atrazine as sort of a combination, which, I mean, this is something that I really, really like talking about because it's very rare that we are exposed to sort of one thing at a time, right? We're not really sort of living in silos where, you know, today I'm going to be exposed to nitrates, tomorrow I'll be exposed to atrazine, the day after I'll be exposed to BPA, whatever. We're sort of swimming around in a chemical soup that may or may not have some interactions that we're just unaware of because that's not typically how we study chemical interactions or chemicals in the environment, chemicals in human health. For adults, the acute health harms, we typically see that just sort of as increased heart rate, this nausea, headaches, abdominal cramping. But chronic exposure, there's some pretty strong evidence that links nitrates with colorectal cancer, thyroid disease, kidney cancer, bladder cancer, and non-Hodgkin's lymphoma. I'm only just now realizing that ovarian cancer is not on this slide, but there has been some evidence also that shows that there might be a relationship there as well. I mentioned at the top of the presentation that I'm borrowing some of these slides from some colleagues at the University of Nebraska Medical Center. And so I learned that there's also a link between nitrate exposure and Alzheimer's, diabetes, and Parkinson's disease. So if you have questions about that, I don't think I'll be able to answer them, but I know the people who would be. So let me know if you have questions about that and I can try to get in touch with folks. There are a lot of studies, sort of like I mentioned earlier, that look at the relationship between nitrates and human health. And if these slides are going to be made available to folks after this evening, I sort of put together just sort of low-hanging fruit bibliography. That's what I like to call it. It's sort of very frequently cited studies in this genre of public health literature for you all to sort of reference, just knowing that this is not an exhaustive list. And I've also included, because I'm sort of right out of time here, a slide on non-cancer maternal and fetal health issues associated with nitrate exposure during pregnancy, in case you all are interested in those outcomes as well. But that's sort of here as a bonus since I'm out of time. Thank you very much for your attention, and I'm really excited about our discussion afterwards. Thanks.